put it on. Some of us were involved in the former POC, although I myself am still a relative newcomer. I'm still learning about all this, I'm afraid. I started in January, so I'm learning as I go. Welcome to Councillors Prince and Sweeting, and may I call you Tony? Is it lovely? Thank you for joining us as well. I have said to members from the Labour Group in the past, my aim is to work collegiately as best we can. I don't suppose we'll agree all the time. However, I think we have a shared interest to work together and be that critical friend. I spoke about it for council the other week, and hopefully we can start in that spirit and move forward in that way. So let me just say that. Welcome also to Anisha, who's joining us as clerk. Steve has moved on, but thanks to Steve, and welcome. Good to have you here, Anisha. With that, on with the agenda. So apologies for absence. I believe there are no apologies this evening.
No apologies.
Okay, lovely. And declarations of interest in matters coming before the meeting. Don't seem to be any indication, so thank you for that. To confirm that the items of business marked Part 1 will be considered in public, and the items marked Part 2 will be in private. And with that, on to agenda item 5. And this is simply around the call-in procedure. So all I really wanted to say about that was that on the 27th of May, all Select Committee members received an email from Democratic Services setting out the process by which a decision that falls within our terms of reference can be called in. As I understand it, it's an electronic process. The first we will know about it is when someone seeks to call something in. It will be then for members to decide what to do about it. That's what I understand it is and how it works. Did you want to add to that, Anisha, at all?
Thank you, Chairman. Councillors, this item on the agenda is to inform you of the new scrutiny call-in procedure. Democratic Services issued the new scrutiny call-in procedure last week following the Council's decision to transfer this responsibility to members of the relevant select committees. The procedure provides detailed guidance along with a guide on how to download or use the new scrutiny call-in app to do this. The key things to note are: 1. All Cabinet and Cabinet member decisions notices now clearly identify the relevant select committee and thereby members of who can attempt to call in any decision. Select committee remits and council service areas who generate the reports based on the decision are now clearly aligned to enable this. 2. The decision notices clearly show the last date any call-in request can be made, i.e. which is 5 working days at 5 p.m. after the date the decision notice was published. 3. It can only be a member of the select committee shown on the decision notice that can initiate any call-in request. A member cannot initiate a call-in on behalf of another select committee membership. The call-in request is done via the new Scrutiny call-in app. This app can be accessed via a link for a computer or laptop, or downloaded via an app if you have an iPad or mobile device. Details how to do this, access the app, have been provided and can be recirculated if required. The app has a simple online form to complete where you can provide details. Once the online form is submitted, the call-in request is then sent via an automated email to all members on the select committee, including the councillor on the committee that initiated it. Councillors do not have to respond to the email, but if they wish to indicate their approval or rejection of the request, they will need to click on the link in the email to do so. Importantly, this also applies to the councillor initiating the call-in request too. Sorry, just a bit more. Upon a majority of members indicating their approval via the app and before the end of the scrutiny call-in period, it then becomes a valid call-in and Democratic Services are notified. On the app, there is a handy call-in history section where you can view the status of any current and past call-in requests. Call-in requests cannot be initiated at formal committee meetings, so those requests that do not receive a majority are not reported to the committee. Only those that are valid with a majority of members approving will then be heard at a committee meeting as part of the next steps in the scrutiny call-in process. If you have any further questions, I'm happy to provide an answer outside the committee. Likewise, any issues accessing the new app, let us know so we can contact you ASAP. Thank you.
Thank you.
Yes, I do. Whilst we're on the issue of scrutiny, I noticed that we have a verbal report today, and it's incredibly difficult to scrutinise a verbal report. So in the future, can we note that these, except in exceptional circumstances, that these should be written, please?
Yeah, I mean, my understanding was it was to be a verbal report. It's not something I sought but I will take advice on the question you've asked. There may be a good reason why it's verbal, I don't know, and I will respond to you on it if that's okay. Okay, can you capture the question, please, Anisha? Thank you.
Thank you,
You happy
Chairman.
with that for now? Okay, thank you. Great. So that
with your permission, Chairman, I'll introduce the report. Just a few words to say. Yes, as you correctly said, Chairman, this the intention with this report is it sort of represents the move towards an annual cycle, which will mean that that this committee will have the opportunity to consider the update on the delivery of the carer strategy before it goes to Cabinet. The report that's before you today was intended as part of that annual cycle. We were sort of moving towards a business as usual approach in implementing the strategy, which we've been quite successful with, I think, over the last few years, to the point where the importance of actually addressing, recognising and addressing the needs of carers is actually recognised across all partners. And you'll be interested to know that a similar report to the one before you today was actually considered by health partners yesterday, and I can provide some feedback on that later. We will all have been aware, of course, that we've been hit by the pandemic over the last year, which has thrown a number of things off course. So the report actually identifies progress on those specific actions that were identified for 2021, but also sets out how partners have responded to the pandemic and the pressures that the pandemic has actually placed on carers, particularly those people who have actually suddenly become carers. The report also identifies a number of suggested priorities for 21-22, which will be discussed further through the Carers Forum and consulted through the Carers Forum. But would welcome feedback from the committee and any questions that the committee may have. Thank you, Chairman.
Thank you very much, Gary. Well, first of all, has put an enormous level of challenge both on our carers and indeed those who support them through the partnership, and clearly there's been a need to innovate and do things differently, and I think people are to be congratulated for what they have done in that regard, because it's such important work. I'll say a bit more at the end about that. I'll just a couple of questions if I can just get the ball rolling. Just two for me really for the moment. I'm looking at the point about carers assessments. I can't find the page now, but we're talking about the number that have been delivered. I'm struggling for the page. Perhaps you can help me out, Gary. Page 5, I beg your pardon. Page 5, yes, so it is. I suppose my question was, when we say a number of carers assessments have been carried out, there's reference to circumstances in which a fuller assessment is deemed appropriate. I just want to get a sense of where we are in that regard, to what extent are fuller assessments required, and where support services in some shape or form are required. Where are we in relation to providing those things. I just want to get a sense of the carers out there and what they're getting in relation to what they need, I suppose. That's that question. I hope that's clear enough, Gary. So I'll leave you that one to begin with, if that's okay.
Yeah, certainly, Chairman. I think the purpose of the triage assessment is really to identify whether the value for the carer in actually going through the full carer assessment process. Because I think one of the things that we do actually need to, I think, point out is that the Hillingdon Carers Partnership have been particularly successful in securing additional resources to provide a range of services that carers can actually access without need to go for the full assessment, or actually without the need for a triage assessment for that matter as well. I think the way that things have actually developed during this year, again, the Hillingdon Carers Partnership has been very successful in developing alternative ways of actually meeting some of that need.
Thank you, Gary. Thank you. And just one more before I open up, if you'll indulge me for a second. In terms of wider performance context, if you like, obviously I'm familiar with the carers assessment one from the Best Care Fund days and the Health and Welfare.
Yeah.
I just wonder what else. If that's not a clear enough question, I'll try again. But what I'm getting at is, if we're looking at this now, and it looks good, believe me it does, but in terms of performance, what it looks like, perhaps comparative with other locations, give us a sense of what else is out there to help us get a handle on that.
Well, there's the number of carers that are actually going on to receive respite and other support services, which there's an adult social care outcomes framework measure on. The carers assessment is actually also an outcomes, an adult social care outcomes framework indicator. In terms of other national indicators, there is the biennial carers survey that's actually undertaken. So that's undertaken by all local authorities throughout the country, which actually tests, put it another way, actually asked carers their experience and whether they feel that they're actually getting enough support, whether they feel that they actually have enough sort of social activity, whether they're feeling socially isolated themselves. Perhaps if there's a link to those. Yes, certainly. Yeah, certainly. Just to give us a fuller picture, really, of how that is. But that's fine. I'll shut up for now. We will open up for any questions. Obviously, Jan.
Thank you very much, and thank you and your officers for doing all the work that you've been doing. We realise it's been very challenging for you, and we do appreciate your work. I have got 3 questions to kick off with, if I may, Chairman. The first is regarding numbers. I mean, I know we're as far away from the 2011 census as we could possibly be, and we wait with trepidation the census information coming up next year. But we've relied on projections to see where we are with the numbers. And I know a lot of carers don't consider themselves to be carers. I know that's another issue. But with the pandemic, obviously numbers have increased. I mean, in fact, your top of page 4 sort of describes that. So has there not been some sort of work done by the council to actually try to come up with a better idea of the number of carers that there are, and to sort of highlight the fact that some carers don't consider themselves to be carers? I mean, that's my first question. And if we can just look at the word delivery plan achievement, I think there have been many, but there are also challenges. So I think it would have been quite useful to have had achievements and challenges. And I know that you've addressed challenges, but there are more challenges to come. So maybe just on a point of information. And my third question relates to the guide for people suddenly carers. Now, there's obviously going to be many people that have dropped into that caring role because of the pandemic. I mean, suddenly they've found themselves as carers. So I just ask when this guide for people suddenly carers is going to be delivered. And I'm surprised that there's not been one already, because this is an ongoing issue, is it not? That people suddenly become carers.
You like for those, Karen?
Yes, certainly, Chairman. On the first point, there isn't actually any more sort of up-to-date information over and above the census, the 2011 census, and it's that we've actually been working on. And to be honest, it's also the approach that Carers Trust UK have taken. And as the report says, reasons why we've been holding off actually reviewing the strategy is in anticipation of the data from the 2021 census. That will be particularly interesting because of when it actually took place. So right in the middle of the actual of the pandemic itself. But that will give us so completely up-to-date information that we can then use for future planning. Certainly, in terms of challenges, that I'll take that point on board for future reports. Yes, there was there have been. This is a piece of work that has been ongoing for some time. The fact of the matter is that quite frankly, we're not quite there yet. It's not quite at the standard that we would actually want it to be, and we're hoping to have that available for the latter half of the year. I wish I could actually say that it's up and running now, but it's not at a satisfactory point just yet, and we do actually need to consult on the draft with partners and carers. I hope that answers your question.
It does, but it would have been really good to have had that,
yes.
As a document already.
Yes. Yes. Yep. Yes.
I mean, it's not. Just briefly on that, I mean, it's not as if there is nothing for people in those circumstances.
No,
what we're saying is this particular document which we're referring is not available yet. But I mean, we're not saying that there is no support available for people in those circumstances now, are we, Gary?
Absolutely not, Chairman. And the point I made earlier about other partners actually being aware of the Hillingdon Carers Partnership, and to emphasise that Carers Trust Hillingdon is actually one of the component parts of the third sector consortium H4All, which is one of the component parts of Hillingdon Health and Care Partners, the local healthcare partnership, integrated care partnership. They are at the heart of what's actually going on within local neighbourhoods. All of our GP practices are aware of their existence, and there is very strong referral relationships between partners.
I'll come back to you if I may, Janet, if you've got something further. Can I pick up Tony? Tony, you had a question?
Thank you very much for this report and the work that you do. This last year must have been very trying. My interest was sparked by the case study at the bottom of page 11, the young child. It is not a particular question on that particular child, but a more general one. Is there a lower age at which you would have to relieve the child of the responsibilities and take the child into care. And do these contacts with child carers normally come direct to you or via the schools? And do you have any obligation to inform the schools anyway?
Yeah, I'm afraid I'm actually going to be I'm not really in a position to answer that question. I think that's something that we're going to have to come back to you on, or unless my okay.
Unfortunately, because I represent the adult social care side of things also, I can certainly speak to my counterparts in children's services and come back to you with the answers to those questions.
Your pardon. You've got the request, though. That's amazing. Okay, thank you. Right, thank you for that.
Thank you, Chairman. So going back to the development of the guide, I'm just thinking about the young carers and whether that guide will actually be suitable for young carers. Do we know?
I think that we're probably actually looking at two documents, because what we actually have at the moment, I don't think is actually suitable to for both young carers and for adult carers. And what I think we're very keen to avoid is actually having something which is too long.
Okay, thank you. Can I?
Thank you, Chairman, and thank you, officers. And I would particularly like to thank you for the case studies. They're really useful. It's interesting, I think, that we've already today had two questions that mention young carers, because when you read through the update, there is practically nothing. I cannot tell from the update how much work is being done to support young carers, and how effective those interventions are. And I would really like to know more about that. And I'm concerned that if I can't see it, I rather suspect that Cabinet can't see it either. And I'm afraid that these things sometimes slip under the radar, not because the work isn't being done, but because probably we're not shouting loudly enough about it. So I would like to see more about young carers in there, and I would like to see rather more data about it too, please. Measurement and outcomes, please. Thank you.
If I could, I referred earlier to the discussion with health partners yesterday, where, as I say, where I took a similar report, and I have to say that was an issue that was actually raised by them as well, Chairman. So it's something that we'll take back for future reports.
Thank you, Chair. I have a couple of questions that I will ask them all at once, if that is okay. I would like to echo the question that Councillor McMahon raised, particularly in relation to page 5, bullet point 3, ensuring that standardised packs of information for carers are available within the waiting room of GP surgeries. It is imperative that these are catered to a range of age groups and circumstances, because it is not a one-size-fits-all scenario, as I know you're more than aware. So is that on the radar, that a standardised pack may in fact be the wrong approach, and that tailored packs might be more suitable? If I ask them all, and then I'll come back to you. The second one was page 5 again, under carer engagement. There's 63 carer participants attended online carers forum meetings. Why so low? Do you receive any feedback that the times don't work, or is it struggling to engage with people to attend? Is it lack of promotion? Is there an obvious obstacle there that means people aren't attending? And page 7.20, regarding responding to demand for emotional support, the additional grant to Hillingdon Mind, which is absolutely essential. I'm interested in why that's £30,000. Is that something that Hillingdon Mind had indicated that they would need, or is that something the council determined would be appropriate? I'd be interested to know how that number was reached. Okay, yep.
Yes, though I have to say there is a risk I shall forget the questions unless we can actually... and talking of which, could I apologise, but could you remind me what the first question was, please? That is a point that will be taken back to the Carers Strategy Group for consideration. I mean, it is. I think, as I was sort of saying earlier, really, it is recognised that one size fits all approach isn't necessarily appropriate given different perceptions, and that will be taken away. That was actually good. That was actually better than the numbers that had actually previously attended the in-person meetings. It's actually quite difficult to set up something that pleases all the people all of the time. And I think probably different approaches again will actually be needed going forward. That was what Hillingdon Mind had actually requested.
Councillor Haggard, you've been patient. I overlooked you, forgive me. Would you like to ask your question now? Or make a comment?
Yeah, thank you, Chair. I have to make comments, obviously, I care as champion, so it's the report. It's been a very challenging time, and you've done the report really well, Gary, and thank you for that, and putting on here really good, sound evidence. It has been a challenging time for carers. It's difficult reaching out to carers. That's really hard, and to getting them to see that they're carers. Two things I would like to just highlight in here, and one thing maybe to bring back as well, Gary, is that we have got a separate group as well now working around the mental health of carers, and that started about 4 or 5 months ago. We have found, if you look at page 7, we've found there's a 45% increase. I mean, that's nearly double. And we're visualising that in the future that's probably going to get even more as we're coming out of lockdown. I think my question, Gary, is how are we going to manage that going forward? Because I'm sure it's not going to decrease, it's increased. I mean, one of the beauties of the pandemic was that we've actually learned to do things other than face-to-face, which has actually been really encouraging, and that's actually really supported our carers because they can actually do it via telephone and Zoom in their own home, which they haven't been able to before. So I think my question is, can we just look around about how we're going to manage that going for the future? I know it's something we're talking about, Mind are aware, and I think very, very good again that we're working in partnership, which we've never actually done before. So each partnership is taking on board their area. But if we could go back with that, that would be really good. I took on board, actually, I think it'd be really good to have the challenges. I think that's really important because one of the challenges are double carers, as we know, people caring for more than one person, that we're trying to work out how we can make it easier for them. And that has definitely been one of the challenges that Councillor Sweetman brought up. The other thing I'd just like to point out is that I think it's such a hefty report. It's very difficult to actually get an overall picture. So I don't know whether there's something we can do, but I would like to have seen it in a bit more of, I mean, I love charts and pie charts, and I think it would have been really good and shown a bit more of how the work has been done if we'd had like a pie chart. These are the young carers. This was like, say, 700 young carers, 20% access this, so many access that, so many access this, because they have, but it's just not in the report. And the same with the adult carers as well. I think you can sometimes get bogged down with the numbers when they're in the report, actually in paragraph format, rather than in a pie chart or that round off. So I don't know whether that's something we can bear in mind for next time. I think it would just be easier for us to see what they've all accessed. Thank you, Chair.
Apologies. haven't quite got used to this yet. I think in response to Councillor Hagger's point about the broader mental health needs of carers, I think that actually fits into the broader discussions that are taking place about the impact of COVID on the mental health of our residents. And we know that there are already meetings taking place between Mind, CNWL and other partners, but I think it does actually need to fit into the bigger pieces of work around development of mental health services in response to the COVID legacy, really.
Yes, thank you. I'd like to sort of highlight page 4 and the top of page 5, which is the carer leads in GP surgeries, the role explained. Now, I don't know if any of you have tried to contact your GPs lately, but I was 25 on the list of people that were wanting to contact the GP. Irrelevant, I know, but my concern is we're asking our GP surgeries to do quite a lot. And is there any way that we can support them in this endeavour? Because I think they're, at the moment, completely swamped. And trying to facilitate improved carer health and monthly carer health checks, is that not going to be difficult for them to deliver under the present difficulties? I've got a couple more, if I may. I might as well get them. Oh, yeah.
Okay, you've got 2 more then. Gary, if you wouldn't mind on that one, please, we'll ask them to ask us some other questions about those, if that's okay.
I mean, in response to that particular question, one of the priorities that have been identified for this year is about actually resurrecting the role of the carers lead within GP practices. Because quite frankly, given what, excuse me, I'll just destroy the equipment. Given the experience of the last year, it's just one of those roles that's realistically gone into abeyance. So it's something which is actually going to have to be resurrected, and there is going to have to be work with the GPs to look at how that's actually implemented effectively. And I think, quite frankly, when it's going to be a real challenge to get a uniform approach across the borough all within 1 year.
And yes, I'm going to talk money now. The triage information, page 6, how many have been financially supported by that? And if I can link it to, are the hardship grants continuing? That was another issue that was highlighted in the report. And the third thing about the coverings, and I can't think of the phrase now, but this was available in the north of the borough and the centre part of the borough, but there was no outlet in the south of the borough. Was there a reason for that? The PPE.
Well,
I can't. Yeah. Right. Right, because in future, I mean, hopefully not in the future, I know that we've had problems with people living in the south of the borough having access, even going to Uxbridge to collect items. So, food bank, I'm thinking of food bank here. So I'm just highlighting that it would be good to have had a centre, further in the south. I'm sorry, I'm not making much sense, am I? But
No, you're making perfect sense. I do entirely understand where you're coming from. I think one of the issues is around how that would actually be resourced, but I mean, hopefully it won't arise again. But if it does, then that's something that can be looked at. The hardship grants have been funded through through externally provided resources. What I don't know is whether those are still available, whether the funding has actually been exhausted.
Answer. Are you saying the funding is exhausted, or you don't know whether they're available? I miss your answer.
I don't. The response is I don't know whether the funding is actually still available, or whether there is actually any that's unspent. So
we could have that information.
I would have to come back on that. Yes.
Yeah. Okay.
And the triage assessment, how many carers were actually supported, financially supported?
That I would actually also need to come back to you on.
Can I just make the point? I'm as guilty as anyone. We do need to use our mics. I'm being pulled up here by Anisha for not using mine, but it's just, I think the acoustics are such that we need it in here, so thank you for that. And thank you for your answers. I'm sort of looking around the room now. We've had quite a discussion. Kerry, I'm looking at you. You hadn't anything further to add, had you? You had? Go ahead.
Thank you. Just one more before I say that. I just wanted to echo what Councillor Sweeting said about a space in Hayes to collect PPE, especially during a pandemic when people do not want to travel by public transport, high levels of deprivation, many people don't have a car. I do not expect you at all to respond again. I just wanted to have that on record, why that was so important. My question is on point 34, Triangle of Care introduction. So that's page 9. The Triangle of Care devised by Carers Trust UK in 2010 and will be implemented in Hillingdon in community teams in 2021-22. That's an 11-year gap. Out of interest, is it why was there a different shape that we were using?
I'm unable to respond to that. I'm afraid that's really an issue for C&WL.
Mic on. Okay. So no one else is indicating, so I'll sort of try and wrap this up a little bit. I mean, we've had a good discussion. I suppose the thing for us, Gary, is that as a committee, what we want to know is that services are as good as they can be, and we're asking the right questions to make sure that things are happening are in train to make them so. So I suppose that's the thing. And what I'm taking from your answers are the various points that have been raised are actually being worked up as part of the carer strategy. And if we can have confidence in that, that's great. That's what we're after. If there were things that perhaps weren't being picked up, then I think it may be incumbent on us to be suggesting such to cabinet colleagues, perhaps. So I suppose it's just knowing the difference. But what I'm taking from what you're saying is the points that are being made are recognised and are already being based as part of our approach. And if I can take that, then that's fine. In terms of the overall report, it reads well. I mean, I hear what Councillor Haggard says about charts and what have you. That may certainly enhance our understanding of what's here. I note the point about children's services to children, young carers, and as my late grandfather used to say to me, let's not hide our light under a bushel. We're doing a good job there. Let's not be afraid to say so, because I think that's a really positive thing. Other than that, clearly a very challenging year. We've done great things with mental health for carers. That's clearly a huge thing. When people and carers have been shut up in their homes with the cared for, that's put huge strains on them. But overall, in partnership, it's been a tremendous thing to see how we've come together, how we've innovated, how we've been creative in terms of how we provide services. So I would ask, on behalf of us all, for you to take those comments back to the officer team and indeed to our partners. Okay. I think in terms of the report itself, I mean, we're being asked to note the report and indeed the priorities that have been identified. So can I take it that we're content with that? If I'm looking around the room, is that okay? People are nodding. Okay, well, thank you very much indeed. That's agreed. Gary, thank you very much indeed. Good to see you again. Thank you. Lovely. Thank you. Lovely. Oh, Anisha wants to add something. What have I forgotten?
Nothing. It was just following the report from Gary. Does the committee have any comments that they'd like to agree this evening to be presented at Cabinet, or would you like to delegate to the Chairman and the Labour Lead to confirm some wording?
Okay. Again, I told you I was still learning about this process. I mean, what's happened in the past is the comments we've taken have been sort of picked up and sort of worked into a form of words. I mean, I'm happy to take it offline and agree some wording with Kerry, if you're in agreement with that. Would that make life easier? So, okay, let's agree to do that if everyone's happy. Thank you very much. Lovely. My mic on again, and I believe we've got presenting on this. Bear with me. We've got Sasha Jeffrey. Good to see you here this evening. This leads on nice. This should warm us up nicely for the next item on the agenda as well, actually. So I was looking forward to this. Please, in your own time, please take us through it. I'm sure we'll have some questions. Thanks, Sasha.
Thank you for having me here today. This is my first time at one of these meetings, so it's been very interesting. I was asked to prepare an update report for committee on the performance of the telecare line and out-of-hours service delivered by Anchor Hanover. Overall performance has been very good over the last few months, especially considering the pandemic. They've coped extremely well. I've presented some stats in my report, and they are consistently meeting the target levels for answering telecare line alarm calls within 97.5.7 seconds. 60 seconds. All calls, 97.5% calls should be answered within 60 seconds. That's the easier way to say it. So they're consistently performing at that level. We have noted that a few months last year and early this year, the out-of-hours calls weren't answered quite in the levels that we were expected, but it's very, very small percentage, and the last 2 months they've been above target. So that's quite promising, and of course we'll continue to keep an eye on that. The calls overall have been what we would expect, with a higher number of calls in antisocial behaviour, social care and repairs. Telecare line still continues to be a really important service, and we've got many residents taking up the service. The contract with Anchor comes to an end in December 2021, so we're currently undertaking or starting to undertake some market testing to see whether we would wish to use another provider or perhaps use a different approach altogether. Does anyone have any questions?
Thank you very much. Yes, I was just going to ask that. Any questions for Sasha? So I'll take Jan first. That's all right. Jan? So Kerry's deferring to you. There we go. How about that?
Oh dear. Thank you very much, and we do appreciate the service. I mean, yes, we've had comments from our residents about it, I'm sure all of us. I think in future it would be really good to have had some comments from the users. You know, we're very much in the business of seeing what our residents are saying, and whether our residents are able to provide us with some information that would improve our service. And so if that's possible, that would be, I think, useful. I would find it useful. I think that what this shows is that you are already undertaking a sort of review of all of this. And as it links to our major review very well, as the chairman has said, one has to sort of ask the question, is this already, the work on the review that we are going to be looking at, the review, already sort of in process? I mean, I'm a bit worried about this issue, because I've been on other committees where the major review has sometimes been something it's already been decided. I mean, there was definitely a one on Respock where it was all about charging for council services, and it was 89, if not 90% already done. And what we don't want to have is if you're already undertaking this work, then okay, it would be interesting, but you know, is the report already partly written is my concern. So I don't know whether you're able to respond to those two issues.
Well, thank you for those comments. I totally take on board that you'd like some feedback from service users and customer satisfaction information in the report, and we can include that going forward. I know we often have good news stories in Hillingdon People, and Anchor do a customer satisfaction survey regularly, so we can include that in future. Thank you. The review, it's a whole telecare area. This is a small part of what the report that Darren's going to present today. So by no means has any decisions been made or any any agreements made. It is just a very small part of a much bigger piece of work. But we just need to make sure that we both work in tandem to make sure we cover everything.
I mean, just to echo that, I mean, this is a much bigger piece that we've got coming up. There's an enormous amount of scope to develop things without conflating the two reports. It's clearly hard to separate them, I understand. But I think you'll see when we come to that paper, you'll get a sense of the breadth and depth of the opportunity there. So I think this is, as you say, just one a relatively small area, albeit an important one, of what we're talking about. So thank you for that. Any other points from anyone?
Yes, thank you. Thank you for the report. It's concise and it's really good, and it's such an important service that we're offering our residents, an incredibly important service. Just one thing though, I would have liked to have seen in the report was the number of clients that are under 65 as well. So I'm looking at the disability sector, epilepsy, and we do such great work. We must remember that this is not all about people over 65 either. So I would like to have seen that included in here. I think just to give us an idea of whether we're increasing in our services, for under 65 people with disability, what that's looking like. I didn't want them to be left out. Thank you.
Sasha?
If you don't mind, thank you, Councillor Hagger. We have actually discussed this very recently. I'm not sure why, but we only seem to report on, it was originally 85 and over and then 75, and we have actually started from this financial year recording the stats for under 65, so I'll be able to include that next time. Thank you.
Thank you. I had two questions, the first of which you answered, that I felt was actually a bit of one of those silly questions that people are embarrassed to ask, but you actually answered it already in your opening statement, so thank you very much for not having for me to make myself look silly. Just a brief comment, I suppose, rather than a question. The current number of telecare line users is 6,812. What I would find very interesting is seeing how this is spread out geographically across wards. So do we I suppose logically there would probably see much a significant concentration in areas where there are more older residents, but it would be interesting to see the geographical spread of this over the borough.
Thank you. This is something that we do currently report on, and it normally goes to the head of the communications team, so perhaps I can include that in future. Thanks.
I've got a question, Sasha. The point in the bottom of page 14, that we're talking about people who are frequently using the service, perhaps suggesting there's a need for some form of social care intervention. I'm just wondering how we use the information that's forthcoming from that, how we apply it and how it works in the context of the primary care networks and what have you on the preventative side. Can you tell us a bit about that, please?
From that report, we do identify what we call our frequent callers, so the people that are contacting us most often, and we have data, or we can drill down data into what's going on. Are they pressing their pendant by accident, or are they frequently falling, that kind of thing, or perhaps they didn't realise they've activated it. So we do refer it back to our social care direct team, who normally make contact with the resident and their family just to sort of get a picture of what's going on, if they need any more intervention, if they need signposting anywhere. So I think we're doing quite a good job with that and following up on where people might need more help. It may not be council intervention, but it could be signposting.
I'm sort of looking around the room and no one else is. Oh, beg your pardon. Tony, you got a question?
Yes, Chairman, I'm aware this is not my area, but I hope you'll indulge me. The paragraph to which Kerry referred talks about half the users using the mobile responder service at tiers 2 and 4. What does that mean?
For people that don't have a next of kin or a carer, and that would be tier 2 or tier 4, the council provides a mobile response service. So if the person activates their pendant and they're in trouble, then we will send somebody round to check that they're okay. So that's the difference. It's just levels 1 and 3 have got their own named responders, and 2 and 4 haven't got responders, so the council will cover that.
Thank you. I can't see anyone else indicating, so let me wrap this up, then, if I may. I mean, it's great to see the progress that's being made. I mean, telecare has been really front and centre of our prevention offer, if you like, keeping people independent at home for a long period of time. That's of enormous benefit to the health and social care economy. So I think we all recognise that. I think, and I note the point about feedback from users. Anecdotally, I mean, certainly my mother and mother-in-law use it. When I can persuade my mother to wear the pendant, certainly it's a great reassurance to her and to us. So I think it does a great job, and look forward to seeing what opportunities may develop over time to shape this service further in the context of what we're about to talk about in the next item. So thank you very much indeed. We're being asked to note the report. Are there any other comments or questions? Can we agree that? Is that agreed? We seem to be nodding. Thank you very much indeed. So that's agreed. Thank you. That's the telecare service update. At which point, I think, sorry, my mic's on. You're looking at me, Anisha, reproachfully. My mic's on. Okay. So moving on then to paper B that we should all have in front of us. And I'll just introduce that, if I may. So Darren Thorpe, who is Head of Business Delivery and Market Management, is here to support the discussion and provide professional advice as required. This is the first time actually I've seen one of these scoping reports in this role that I'm now in. But as I understand it, essentially what we have, and if I can just introduce it, on the back of our discussion back in April, when we decided to take assistive living technology as our major review for this year, we at that point commissioned a scoping report, and the aim was really to set out the breadth and depth of the opportunities that exist within assistive living technology, and it really is quite substantial, as we can see from the report. The idea of the report really is that we've, in essence, what we've got to consider is a draft terms of reference on page 2, prospective lines of inquiry on page 5, and that's witnesses as well, and also a schedule for the review, which is on page 6. So that's all there for us to consider and or amend as we see fit. I think I'll probably just chip in first of all, since I'm speaking already on a couple of these points. I think in terms of the witnesses, what I couldn't see and what I think was worth including is Brunel University. We have a long-standing relationship with them in terms of developing state-of-the-art social care support techniques and what have you, and it would seem worth seeing if we can harness their expertise as part of this. So can I ask that we add that, or at least explore it? If there's a good reason why we shouldn't, then tell us, but otherwise I think it's worth considering. Any comment on that?
No, absolutely, Chairman, so I've made a note of that. Yeah, thank you.
I would say, first of all, and in terms of the terms of reference, I mean, I was going to ask you, Darren, how you arrived at that, but I mean, the point I would make is, and it may be implicit within this, maybe I'm over-reading it, but I think the point about really supporting people to live well with conditions, the whole well-being piece needs to be really very much part of this. Now, that may be implicit here, but I would ask the question because I think that's something that we would be very interested in seeing, because you know the social care economy, the health economy, really needs this to be an opportunity that we seize, and I would strongly suggest that that is part of what we're talking about. Perhaps you can assure me on that point. Let me perhaps hand over to you at that point. How do we get up to this total reference, and can you just give me some comfort around that, please?
Thank you, Chairman. Okay, so considering the scope of the review, The terms of reference sort of outlined the process to commence understanding initially what our current offer is, and that's covered by point 1. Then also looking at other examples of best practice and following an ordinary project approach of understanding the marketplace, new entrants to the market, but also the demand. So again, service user feedback, feedback from direct provision, care provision partners as to the opportunities that we feel are available through the delivery of and the improvement of assisted living technology. The other aspect, obviously, is through the pandemic, we've had to think a little bit differently outside the box, if you like, about how we can try and continue to deliver those services. And again, it's then forced or provided an opportunity to consider the wider applications of some of those services. So this review felt timely to include the wider scope of assisted living technology, and indeed colleague Perry Scott is presenting to the HIT board this evening the council's digitisation strategy or proposed strategy, and again this would feel timely and would fit in with that whole infrastructure, because then we recognise that there are some parts of the borough that don't have the adequate Wi-Fi connection, 5G, etc. So if we are looking to make recommendations for further improvement of technology, then again we would recommend that we do that alongside other projects that are happening in the council at the moment. With regards existing services, again links in with the previous report, an understanding of the existing telecare line as a starting point, and use that as a platform on which to build the wider opportunities for assisted living technology, and include services which some of our residents are already comfortable with, and therefore build on that as we introduce more or the opportunities for more technology to be used by carers and care providers.
One comment on that before we open up for questions and comments. I think I'm glad you mentioned sort of post-pandemic healthcare, because in actual fact there was some discussion last time round about possibly making that our major review item. I think the argument that I advanced on that occasion was now is not the time. The health economy is just not ready for that, given where we are with the pandemic. We haven't come to a landing on it by any means. So the point I would make is these are not mutually exclusive. Yeah, post-pandemic healthcare is very much linked to this, and in fact we've learned a lot in the last year about what needs to be different that we can pick up as part of the review. So I would just really like to make that point on the back of the discussion we had last time. And with that, let's open up. Any comments or questions? Jan?
Thank you very much, and thank you for the work you've done on the scoping report. But can I wind back a little? We are actually, we've morphed two committees into one. We've morphed the committee that you were chair of, and you've also morphed in the committee that I was a lead on, which was the ReSpot committee. And we've come together because it's including education and other services. So you mentioned the word we. You know, we in April agreed this scoping report, this major review, but we are not the same we now as we were in April. There's a different we here, and I know that my previous committee, ReSpot, had various very serious issues that we'd put forward as a possible major reviews, and particularly on the young people side of things, because we were talking about early years, we were talking about youth services, all things that have been very much affected by the pandemic. And I recognise that this is a very important issue. I'm not trying to decry that, but is it not possible that we as a committee, now that we've morphed from two committees into one, that we would need to actually look at those areas of work that were as part of the old ReSpot as well as the old, and I can't remember the name of the other committee that you were chair of, I'm sorry, so that we can sort of come to a decision that this is the major review that's the most important to be considered. Is there that possibility that we can just row back and think again?
Well, I think, okay, I'll try and answer that. I mean, okay, I'll take your point about the we. Yes, it was not yourselves, clearly on at the meeting in April. I think we've made a decision about a major review, so I'm not quite sure whether you're suggesting can we add other bits to it, kind of thing, or can we perhaps have another review, or perhaps bring other things in. I'm not. Can you just clarify what you're suggesting, Jan? I'm not quite sure I've understood you.
I'm suggesting that another review could be on something like early years or youth services, because both of those areas have been challenged by various issues in the last, not only the last year, but the last few years, and they haven't been looked at in the past for quite a while as a major review.
Okay, I mean, I think, and I've asked the question in general terms in the past about major reviews, how many can we have at any one time? The answer is only one. We can always have a report and a paper on whatever we like. That's within our gift. If it's within our terms of reference, we can certainly do that. Making a major review of another topic that's unrelated, I don't think that's something we can really entertain, to be honest, given what we've decided. If we can certainly look at the issue that you're asking about, and I can get advice from Democratic Services as to what the possibilities might be. But if you're suggesting a sort of major departure from what it is we've got in front of us, then I think that there's an issue with that I would have to take offline, to be honest with you.
I mean, if I can just respond to that. Yeah. Certainly, the two issues that I've highlighted, if you look at the work programme, you'll see them right at the bottom in very faint wording, because both of these issues have been reported many times within RESPOC, and we've asked for them to be included, and it is now on the work programme without any dates against them.
And yes, you're moving forward a couple of agenda items, but yes, indeed, it is on the work programme, and I was going to move that we do take them as items. We're going to have difficulty having a second major review. We can certainly have a report and a paper on these items. That may prompt further questions. We can explore that more fully. But if the suggestion is we have another major review at this point, then I think the answer, I'm sure if I ask the question, the answer will be no, because I've asked it before on other things. I'm very happy, and certainly without preempting our decision making later in the agenda, I'm sure we'll take them as items. As to there being no date, well, the trouble with that is we are in the hands of officers to some extent on that in terms of what's available and when, and we have to work with Democratic Services on that. I'm sure we can get dates in pretty short order, hopefully. Let me give you that reassurance at least, Jan. I think bigging this up beyond what it already is. I mean, this is a pretty meaty piece of work already, to be honest with you. It is quite substantial. So I'd be loath to say, well, let's sort of add to it or make it bigger. We can certainly look at the items you talked about without a doubt, because we care about those things equally, believe me. Okay, so you may not be entirely satisfied with that answer, but that's where it is, so I'm afraid, as far as I'm concerned. Any other points on this? Judith, you're waiting.
Thank you, Chairman. I would like to underline something we were talking about earlier, which is the voice of our local users and their carers. And I would like, it says on the evidence and inquiry, either in person or through a survey. I don't see why we can't do both, and I would suggest that the in-person would be in an informal setting rather than this kind of committee. I know we've done it with other reviews, and I think it would be very helpful here.
I concur. I mean, I don't know about colleagues. I mean, there's already a bit, and if I don't say this, I know Kerry will later on, the bit about directly involving service users. We're already talking about visiting Grassy, Parkview and other places like that. So I would like to think we can weave that into the programme, because that would add value.
Absolutely. And I think the intention was to offer both in person and a survey response.
I have a few, if you'll humor me, please. I think that the terms of reference perhaps doesn't go far enough. So whilst absolutely valid, of course, to look at best practice, what we offer, how it can be improved, I would be very interested in finding out about the limitations that people face accessing them. So I would be interested on, for example, when these products are provided, how well are they shown? How well are people shown how to use them? Do we cater properly for people for who English isn't their first language? Do we? I did have other points. I've written them down. So generally, the barriers that people face, how can we improve awareness about them? I would like to know more about the process. This isn't my area of expertise, but the process around, are these technologies requested? Are they offered? What's the take up? There's a whole other area, I think, that we're missing, which would make our work on this not as impactful. If we can find out why it is that people aren't using, they might have devices that they're not using, and looking at why that is, I think would make this review even more worthwhile. Thanks.
Comments on that, Darren?
Yeah, absolutely. I'll take that on board. I think with regards to the ability to use equipment and limitations, I think we do that as a broader market scoping as to the demand, the current take-up, and a full oversight of the current usage of those services. That would then naturally lead itself to, if we know there are a wide range of products available, why such a limited number are being used. When we look at the demographics of the current service users, is there a particular market or area of the borough, etc., that where take-up is low? That could be infrastructure. As I say, we know there are some parts of the borough where Wi-Fi connectivity isn't as strong as it could be. And again, the digitisation steering group is looking at that, and this work stream will work alongside that group. So yeah, I think we can expand the terms of reference to suit the committee to include that area of work, more of a wider market engagement and mapping exercise.
Thank you, Chair. I'm just thinking, in order to gain a better understanding, would it be possible to actually see some of the apps that are used? Like, I'm just thinking on the last paragraph on page 3, it mentions all the apps that are used in the care homes. Is there a possibility to see those apps?
Yeah, I'm sure we can. Yes, we can arrange. Yeah, so we can arrange demonstrations, and particularly as we then ourselves do a market scoping exercise on the supply side, then again, as we work with those suppliers, part of our process would be to invite them in to demonstrate the services and apps that they have available.
Thank you. Under potential witnesses, what could be quite beneficial is having some kind of advocacy group, perhaps Age UK Hillingdon or a group like that who work with people on a daily basis, more of like a collective voice as well as individual service users. Maybe they spot things from a support side rather than a user side that could be useful. I wonder if that's an opportunity to add as a witness, potential witness.
See no reason why not, unless Darren's going to contradict me now.
No, I've just noted that down to take those umbrella organisations as well. Absolutely, Chairman. And again, just to set your minds at ease there, when we're looking at the other projects that have been undertaken across London, by no means do we want to start with a blank sheet of paper, but we can see what else is being undertaken, and bodies such as the LGA and any scoping exercises they've undertaken will help feed into our project.
If there's any other comments, I mean, you've taken down quite a few things there, and I'm not going to try and recite them all. I mean, a fair few I've got up here, but Anisha, no doubt you've captured all of that, so perhaps if we can circulate those items, it would be helpful for just to aid our understanding of what we've agreed. But I think those additions hopefully will enhance our approach to what we're doing and maximise the opportunity we can get out of it. I mean, it really is a mouth-watering prospect getting into this, because it's a huge opportunity. It really is. I know Jan is shaking her head and laughing, but
no, if I can just say it's technology, isn't it? I mean,
all right. I'm using a bit of licence there. Fair enough. Okay, so with those additions, can we agree this item then? Is there anything? Okay, yeah, we seem to be nodding. Lovely. Okay, that's that. So we then come back to our next agenda item. Bear with me a minute. So this is the update on corporate parenting, which is a verbal report, and I noted what you said earlier, Kerry, about that, and what I said stands as well. But it is verbal, I'm afraid. We'll find out the whys and wherefores. I think we're starting off with an update from yourself, Anisha, on this.
Thank you, Chairman. At the last corporate parenting panel meeting, the panel proposed amending the terms of reference from 6 meetings a year to now having them quarterly. The dates for these will be agreed, but obviously this is subject to the committee and what they decide, and if they're happy to amend the terms of reference for the corporate parenting panel. If the committee is happy to amend the terms of reference, I can include that in the minutes and also communicate that back to the corporate parenting panel.
Just to be clear, that was agreed by the corporate parenting panel last week. I think you and I were at that in different capacities. And okay, so what you require is our agreement for that, if we're in agreement. Is that right?
That's correct. So members of the corporate parenting panel did propose that and agreed it amongst themselves, but obviously that is subject to this committee's discretion.
Okay. Any comments or questions on that? Are we in agreement on that? Okay, we seem to be in agreement, so that's fine. Anything else on that for Robin and Hina?
That's all. Thank you, Chairman.
That's all you want to say?
Yeah. Thank you, Chairman. Yeah, it was just, I was just going to give an overview of the actual meeting just for members here. So it was quite a productive meeting, Kerry, I think you will agree. And it was co-chaired by one of our care leavers who did a fantastic job. We explored the key priorities as identified by our looked after children and young people, and heard some insights from our care leavers. We also received the Independent Reviewing Officer report, which provided details on the care planning and the review process, and everything seemed to look really good. Overall, the timeliness of review and participation of our LAC and young people reviews continues to be good. So overall, it was very good. Yeah, thank you.
I'm just going to chip in on, if I may, on that briefly, because I came along to the same meeting and I got a lot out of it too. I did ask a question about training, and I ended up being landed with a job, if you remember, because the Councillor Dennis said, could you perhaps explore the question of training? For the benefit of people who weren't there, my point was simply this: we are corporate parents. I've been around a long time. This is a relatively new area to me, and I'm very conscious of the need to show due diligence and asking the right questions. We know that in other places councils have been criticised in certain instances. None of us want to be in that place, and I know that in less than a year we'll have new members and new member development and all the rest of it, but I just want to make sure that we have what we need. We need to be equipped to ask those questions. So I've been on to member development, who's put me on to the Assistant Director for Safeguarding, who's going to come back to me. I don't want to reinvent the wheel. If there's something good out there that we can just look at, that's fine. But if there's something new we need, then I'm sure that we could all benefit. So just ready to report that for you all, and I'll let you know when I get back. That was all. Sorry, do you want to comment?
Only that I know that the membership of the corporate parenting panel is agreed, but can any person on this committee just attend as an observer? Is that possible, or?
The meetings are open to members to attend, not as members of the committee, but as observers. I mean, I did the other week, and yeah, so did you, Carrie. So yeah.
Thank you.
Just on that, in order to attend, I was asked to let the officer know, the responsible, just to be aware, because there are children in attendance. Yeah. Just a decent thing to do, I believe. My second point is this committee not supposed to deal with the membership of corporate parenting, or have I got that wrong? At what point does this committee nominate? I was told it would be at this meeting that the new membership for the corporate parenting panel would be decided here.
Okay, I don't know the answer to that. Do you know the answer to that, Alicia?
Can I come back to you on that?
Okay.
I do think it is nominated here, but I'll need to double check, and I don't want to say just in case.
Judith.
Chairman, thank you. If I can go back into prehistory, we used to have Regulation 33 and 41 visits to our children's homes. I haven't heard anything about them recently. I imagine that they couldn't take place during lockdown. I don't know where we have got to with them and what member involvement there is in them, and I would very much like to know. Is that possible, please?
Hina's indicating.
Yeah, thank you, Judith. It has been raised at the meeting, and it's something that we are going to look to go and actually carry out some visits as soon as it's safe to do so.
Thank you. The Older People's Plan update going to the 8th of July Cabinet meeting, why has that not come to this meeting so that we can scrutinise it ahead of going to Cabinet?
Okay, let me try and answer that. I mean, it's open to this committee to look at anything that's relevant to it. It's been on the forward plan for some time, as far as I know. It could have been asked for at any time. I can only assume that the membership of the former committee, for what reason, chose not to do so. And I can't. It's not for me to justify that. But I think that's the answer, Kerry. To be honest, yeah.
Just to follow up, in 2nd of September meeting, Cabinet School Capital Programme update. Can we get this on the next agenda for this meeting so we can look at it before it goes to Cabinet, as there is no longer an executive scrutiny, so we are the scrutiny body, and I think these should be on the agenda by default, not by request.
And there's always going to be a balance with workload, of course. That's the trouble. The other question, of course, is scrutinising decisions before they're made. I suppose it's more a question of what information can we get about the decisions about to be made, and to what extent can we have input. Now, Alicia, any thoughts on that? I mean, we could ask for a report on it, absolutely, couldn't we? But what we'll get at this stage, I'm not sure. Can you help me out on that?
Sorry, it's another thing I'll have to come back to you, but I will feed it back to you and definitely get back to you in the next few days.
I think it's within our gifts to ask for information, absolutely. But as I say, it's the call-in applies obviously once the decision is made, I guess. So, Jan.
It's dovetailing with that, actually, but I mean, there's quite a few items that are going to the 8th of July Cabinet meeting, and a lot of them are sort of fall to us, and I'm not certain if any of these have come to the previous committee. You know, what's been looked at by the previous committee, and what hasn't. And when it comes to the School Capital Programme, that's the 2nd of September. Now, our 27th of July meeting, if we just look at it, it's pretty heavy as it is. And I'm going to sort of raise that when we come to our meeting plan. But if we've got that report as well, I think something else will have to give. So I'm not quite certain how. You know, we are now a scrutinising committee, and I think I'm finding my way, and maybe the other members of this committee are finding their ways as well. But if we are going to be scrutinising, we need to see things first, I think, and just make our comments, even if it's not any criticism, but just comments going to Cabinet.
Yeah, I mean, it's a general point. It's always going to be about workload, what we want to look at. It won't be everything, clearly, but there will be things we want to understand more fully, absolutely. When it comes to the forward plan, we'll pick up the school capital programme, I suggest, and we'll see what we can do about that, if we're happy. Anything else on this item for now? Apparently not. Okay, so can we note that for now, then, and come on to the work programme? We're going to item 11. So, we spoke earlier about the youth services update and the early years provision, so I move that we include that on the back of our earlier discussion.
Can I just sort of clarify this? The youth services issue, I know, is going to be part of a major review. That's what we've been told, but we've been told that for about 2 years now. So at the last ReSPOC committee, the committee as a whole said, can we please just have a date to when this report on youth services will be coming to us, because it keeps on being sort of hit down the road. And it worries me a little bit that it's in lighter text there. So we do need to try to get a date on both the youth services and the early years provision as far as possible.
As I said, that's not something I can give here and now. We will get dates as soon as we can on that, on the basis that we're agreeing to take these on to our work programme. Yeah, so yes, absolutely noted. Tony?
2 questions, Chairman. One's a comment, really. In relation to the school capital programme, I noticed that we're getting a quarterly school places planning update. And it would seem to me that the school capital programme relates to that and ought to be circulated at the same sort of time. Certainly when they came up together in Scrutiny in days of yore. And my second question relates to our former committee of ReSPOC, that when it was last met was doing a review of adult education. What's happened to that, or what will happen to that?
I honestly can't answer that question. I don't know if Anisha can either. There's a fair few things to find out about, aren't there, Anisha? Have you captured the question? You have. Okay, right. In terms of the school reports, well, sorry, James, were you going to come back for us anymore?
Just that I think it was mentioned in the report that went on Scrutiny reports that went to full council, and it was basically that there will be the items put together because it was almost done, if you see what I mean. Yes. And so the recommendations will be coming. I'm not certain where they will be coming, but they are coming.
Please come in. Susan, come
in. Would we be able to discuss this offline, just so that we can also liaise with the officers presenting the reports, because there may be some reasons why they've been slotted in for those dates, so we'll need to confirm that first, and then we can get back to the committee with new potential dates.
The other,
There's just one other item that we've been asking for in my previous life in the Respot Committee, which is the report concerning Ascend, and that's now coming to this committee in October. So I think that's been about 2 years since we've been asking for that as well. So I don't know whether that can be slotted into an earlier meeting, but it might not be possible now because we might be deferring some from the 27th of July. So I'm just highlighting the fact that that is a big issue, and it's certainly a big issue with some of the residents as well that have got children in that.
What's always within our gift is to ask for information in the meantime. So it might be that we can't very quickly bring a report here, but we can always ask for information to support our understanding of it, perhaps to get some clarity to inform our thinking when we do bring it to the committee. So there is a halfway house, Jan, that you might want to think about in that regard, is what I would suggest to you.